I'm Dr. Margaret Nolan. I'm a research fellow in the Department of Anesthesia and the Nicotine Dependence Center at the Mayo Clinic in Rochester, Minnesota. I'll be discussing with you today a review authored by Dr. David Warner in the Department of Anesthesia at Mayo and myself. It's titled "The Safety and Efficacy of Nicotine Replacement Therapy in the Perioperative Period." So patients who smoke have an increased risk of perioperative complications, including wound and bone healing difficulties, as well as cardiovascular complications. Current evidence and meta-analyses suggest that abstinence around the time of surgery can reduce these risks, but this can be really difficult for patients. One way that we can help them is through tobacco use interventions, many of which include nicotine replacement therapy, or NRT. Evidence does suggest that nicotine replacement therapy substantially increases the risks that patients can attain and maintain abstinence in the perioperative period. The question then becomes, if abstinence is so important around the time of surgery and nicotine replacement therapy can help patients get there, what are its risks? What are the risks of using this therapy in patients around the time of surgery? Some preclinical studies do show that relatively large amounts of nicotine administered to animals can compromise the viability of surgical flaps and bone healing in some models. There are no preclinical studies that examine the effects of nicotine in doses commensurate with those produced by clinical NRT, or nicotine replacement therapy. There are also no preclinical studies that look at the effect of nicotine on surgical site infections, which are the most common perioperative complication that we see. Clinical evidence is also rather limited. The human studies that are available show no increased risk from nicotine replacement therapy for either healing-related or cardiovascular complications. In fact, the clinical trials that are available that compare nicotine replacement therapy and placebo show either no difference between the groups in perioperative complications or a reduced risk of these complications in patients who use the nicotine replacement therapy. So as with any other drug, the risks and benefits need to be weighed when considering the use of nicotine replacement therapy in surgical patients. But almost certainly, it's far better to expose patients to the relatively low doses of nicotine provided through clinical nicotine replacement therapy compared to the high doses produced through cigarettes, not to mention the carbon monoxide and numerous other poisons that patients are exposed to through cigarettes. So, in summary, given the benefits of abstinence and the evidence we have for benefits of abstinence in the perioperative period, as well as the evidence of the efficacy of nicotine replacement therapy in helping patients to attain and maintain that abstinence, any policies that prohibit the use of nicotine replacement in surgical patients should be re-examined. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.